Systems Chief Ike Pareto. We also got Dr. Juan Flores, Catholic Schools Superintendent. A little bit of a check-in here. Now, though, from the Physicians Advisory Group, Dr. Hoa Nguyen is the chair of the group. They just had their meeting last night. Doc, so I guess what were some of the things I discussed in the PAG meeting? Good morning, by the way.
Good morning, guys.
Good morning.
Yeah, we continue to do very good on the vaccination. So, we just briefly discussed to see about the goal that the governor set for May 1st, and look like we are on our way there. We will the word is we will get more vaccine in April than in March. So probably over 50,000 doses total. So it's so if we can get them all out to the people on time by the end of April, that we'll be in good shape and reach that 50% mark or more. So we talk about that a whole lot, and hopefully when they place the order, they come on time and they come in good condition. That we can start using vaccine to probably the first week of April or so. That's the biggest thing. And as we have our people vaccinated, we talk a lot about how to take the approach on changing the quarantine. Once we get to that stage, there's different people that vaccinated or unvaccinated or partially vaccinated. There's a lot of things have to be in place to make sure that the island's still protected. Protect means that number one is the hospitalization have to be nice and low, like it is right now, and also the positivity rate, the CAR scores continue to go low. I think we are 0.2 or 0.1 right now, so it's very nice and low. Also, the people coming in, as you can see, there's some variants. The California variants are here, but so far, because whatever measurement that we do, it's not create any cluster or any type of surge in the community. So far, we want to keep it that way. So a lot of things have to be in place. How to check to see to verify if you vaccinate or not. So that's a very challenging part because right now everything manual. So there's this is hard to check at the airport. So those are very good discussion last night. I said we still 6-7 weeks out. So still in discussion at this point.
So what is the plan or the proposal in terms of being able to track who was vaccinated and who wasn't?
Yeah, that's the thing. It's kind of hard to rely on the little white card that they give to you after your vaccination, because people say that they lose it in a different way. They misplace it, they put in the washing machine, and they can duplicate it somehow, pretty easy to duplicate. So right now we just talk about a lot about how do we prevent that, and also for people who come from off island, what do we accept regarding documentation that they've been vaccinated. So that way, if they're fully vaccinated, most likely they don't need to be quarantined, because the latest study showed that the fully vaccinated person has a much decrease in risk in transmission, like 94%. The asymptomatic one is almost not much of a chance to be transmit that to someone else, even if you have the virus. So those are something that we have to consider according to the guideline and the study, and see if they can just get to go home rather than be in a Q factor. Mm-hmm. The key here is make it so friendlier for our return resident to go home and rather than stay in the Q factor. So I mean, there's a lot of detail have to be discussed, and there's some we meet once a week. I know we discussed a lot over an hour yesterday, but again, nothing firm coming out. I'm going to draft something for the PAC to review, and then they're going to comment again, and we keep talking about it. So we have several weeks to go, so we can take our time and make sure that we don't rush things to open the island, and there's the risk of a surge out there.
Doc, is there any thing national? Like, let's say you get the vaccine, in the states. Is there like a national system of identifying who's got the vaccine and who doesn't? Is there like maybe a more permanent card, or so nobody has any kind of system in place, Guam or the states?
Yeah, there's no national database that you can log in a computer or whatever process to verify that you got vaccinated from either by fully vaccinated or partially vaccinated or no vaccine. So there's nothing national. We probably can create something from locally for the local resident. And that's easy to do. That we can have a database that even at the airport they can check to see you're fully vaccinated or not. So that's for our return resident, that's easy to do. Again, the key here is not so much open for the tourists by May, open the island, but make it so that the travel back and forth from the state for our resident a lot much friendlier than it is right now. But the Q factor at this point does serve its purpose. But when we have certain percentage of our island vaccinated, it's a lot safer. The hospitalization will be much less. So that's the key, is not to get zero positive. There's no way we're going to do that. But the key here is you can have a few positive community, but the hospitalization is low and people are not dying from the COVID. That's the key.
You were mentioning the last time you were on that public health has that database that has all the information on people that received the vaccination, and there were efforts to try and make that database or that data available to I guess private clinics and other individuals. What's the update on that?
Yeah, that's the WebIZ. That's a public health system that kind of track the vaccination and also the inventory and supply. But WebIZ is not really user friendly and it's not really accessible to the clinic nor anyone outside public health. So there's a proposal for a digital platform. I know that I think the chief of staff have, and hopefully if they approve that we can start using on Guam, so that way we can track that the status of immunization for everyone on Guam, and you can access that anywhere, at the airport, anywhere that you need to verify the person has been fully vaccinated. So that's a digital platform, pretty easy to use. I say with some still pending, I guess, a review or the approval from the governor, chief of staff, and public health to be implemented. But that's something that, again, is only for local residents, because you can, certain people can input your database in there and you can access that in the cloud. So it's easy, but that's for local residents. It's not used nationally. Again, there's nothing nationally that we have right now to verify your status.
Mm-hmm. But in the interim, are we going to see like a office over at the airport, like a public health, to open up an office there, so that when people arrive, returning residents, I guess public health can check whether or not they're on the list of, okay, they got a vaccine, they don't need to, quarantine or whatever.
The key here is not just only public health, the custom, anyone that have the ability to log in and check your status. Mm-hmm. Anyone can just on that have the privilege to do that. Even custom, public health.
Yeah, but that would be wouldn't that be like a HIPAA violation? Because that database, it includes all the other kinds of vaccines that you may have received, right? It's not just the COVID vaccine. I mean,
Yeah, right now
I
we
wouldn't
just
want
use
anybody
that
knowing
for,
my
you
information.
no, this one is strictly used for the COVID-19, the Moderna, Pfizer, Johnson Johnson only. It's not used for anything else. I think
Public
that
health system. Public health's current system.
yeah, the public health current system, WebIZ, will track all your immunization. That means that you have
Yeah.
MMR, Tdap,
Right.
anything like that, that'd be showing there. But with the digital platform, strictly for the COVID, for the travel, that's all you see. If you have one dose, two dose, or none at all. But by type your name, it has a certificate there. So that way you know that you what status you are in.
And how soon,
And
I mean, are you guys looking at having that, finalized?
well, May 1st is that's the target goal, so they better finalize that before May 1st, because it's kind of hard to check someone's immunization status if they come in and they say, yeah, I was fully immunized, but they forget the paperwork or the card, so you kind of get stuck.
So in the path to half, it says that you have to have the 72-hour the negative PCR test 72 hours prior to arrival, right? And then you could totally bypass quarantine period. But
Yeah,
but
but
but are you saying that the plan also is if you have been fully vaccinated, that you can also not have to quarantine? But that part of the plan isn't ready.
yeah, that's part of the discussion, and I think the majority of physicians, I don't think anyone object that one. That if you're fully vaccinated already, the latest studies show that again 94, 95%. But if you're asymptomatic, it's on the risk for you to transmit the virus is so low. So the discussion and is pretty much agreed by the majority is that hey, you're fully vaccinated already. You don't need to have that 72 hours. But it does cost a lot. It costs $200 or so in the state to get the PCR testing for travel, and with people with pandemic and the shortage of fund, it's hard for young people to travel and then have to pay out $200 for the PCR testing coming in with that fully vaccinated already.
Right, but at this point, it's not gonna matter whether you're fully vaccinated because we don't even have the ability to track it. Only public health.
But we will. Yeah, I think we will. I think by that time, by May, hopefully, we can want to track the status of your immunization for COVID-19. So again, it's a personal choice out there for everyone. I really highly encourage for everyone to get vaccinated. The safety data is out there already. So it's nothing new, and the efficacy of the vaccine there is nothing new. Even the efficacy against the variants, I think the 4 or 5 variants right now, that is effective against that. So it's a no-brainer for anyone to be able to go out and get the vaccine. It's pretty much available, especially next month is a lot.
Mm-hmm.
So the challenge next month is how to get all this vaccine out to people.
Mm-hmm. I'm sorry. So just for clarification, so when we talk about the vaccine and coming into Guam May 1, this is only for returning Guam residents, right, that got their vaccine on Guam. So it won't matter if, like, my auntie was coming in from San Diego and she was fully vaccinated. We wouldn't have the ability to check whether or not she was fully vaccinated. She'd just have the white card, and that wouldn't be good enough. She would still have to have that negative PCR test.
Yeah, and either that, that's what we're talking about. How documentation do we? Their physician, their medical clinic, that they have the vaccine, even requires the batch number of whatever they have there on each batch. So something that can verify that they have already. So again, those are some of the recommendation, but again, we will discuss more on what need to present to custom in order for you to prove that you're fully vaccinated. Like I said, we a different idea out there, so it's still a discussion. But the key here is not just for the tourists. The key here for to make so that people travel back and forth from the state is a lot easier than what it is right now, and hopefully it'll be cost effective, so people don't waste the $200 PCR if you're fully vaccinated already. It costs a lot to do that in the state, and even here when you travel back to the state now, a lot of people are doing that. So.
The proposal that's before you said the Adeloop that has this proposal for this database that you're referring to, is it something that other jurisdictions are using, or this is just for Guam?
Some places in California are using it. Also, it's not fully implement in like I say, in statewide anywhere.
Yeah.
But that's easiest way to prove that you've been vaccinated. And for the state side, it's pretty hard because it's million people, but in Guam, only 160,000 something people. It's very easy for us to keep the database and contain it and manage it. So that's the advantage of having a small community, a small island. So we just, again, the key here is to keep track of our people here on the island, and find ways to prove that people that off island and live here that come to Guam, that they can present something that's verifiable to customs. So that way, they can, in the future, they don't have to be doing the pre-arrival PCR nor quarantine. It's just make a lot easier. Again, Sabrina, is 50%, 70%, 80%. It's a different milestone that we try to come up with to the more percentage of people vaccinated, we can relax the rule a lot more. Just because again, it's just, the chance that people end up in the hospital is very low, unless there's a new variant that come out there that that skip a lot of stuff, and the vaccine is not effective against the new variants, and everything will go back to the current situation.
Doc,
but hopefully not.
Has there been any discussion on lifting any of the capacity limits for retail or dine-in, or any of business establishments?
Well, the school, CDC now say that they less than 3 feet now, between the student and I think that, as you can see, if our cars will continue to be low, there will be more relaxed of the restriction for the business, especially rolling around May 1st. If we get the 50%, I think you can see some significant relaxation of some of the business restriction.
Yeah, with the schools, it was the 3 feet, removing the 3 feet social distancing between the students, but the 6 feet still is in place for adult to adult, teacher to teacher, adult to student.
What about?
That's for the kids, but for the student and the teacher, it's still at 6 feet. Only when the desks are 3 feet apart, between people and people. But from the teacher to the student, but that's still it's still 6 feet.
So, Doc, just what about for regular people like you and I? 6 feet, 3 feet?
I think as long as you wear masks at this point, against the World Health Organization say 3 feet, CDC says 6 feet. So, to us when we talk about the airport, say 3 feet is adequate. So I mean, anywhere from 3 to 6 feet is adequate.
You mentioned the variant. Has there been any other information regarding results from the other samples that were sent to the CDC for February?
I think they still owe something like more than 20 or so specimen that have not come back yet. The California one is in the variants of, I guess they call them variants of concern.
Right.
So it's, but that's the only one that positive so far. There's none of the 4 or 5 that on the specimen. But I think they still checking every day to see if the rest of the specimen coming back yet or not. So as long as we just on the specimen on the variants of concern, we're doing okay. Anything higher than that, then we're in trouble.
Well, then isn't there only just 3 categories? The variant of interest,
Yeah,
variant
the
of
3
concern,
categories.
and variant of high consequence?
The interest, the concern, and whatever that high
consequence.
Consequence. So
Yeah,
we're
high
right in the middle.
consequence.
Yeah, we're right in the middle
Yeah,
there.
right in the middle. The high consequence, if they have one like that, well, I tell you, we probably go back to lockdown again if it's a high consequence. But I don't think that none of them are there yet.
But Doc, what if we got the samples did we send samples from last year? Because back when Dr. Cabrera didn't have a problem with coming on this show, he told us that we sent off samples from like November and the second surge.
Yeah, we don't send anything beyond that. CDC do what they do all the time on specimen sent to them. Even if before this they do the genome sequencing, to make sure that none of the virus changed significantly to a point where they skip the first 2 level. So those are something that, just like the flu vaccine, right? You collect something from last year's specimen and you make the flu vaccine for the next year.
Yeah. So,
that's something that they always do on any type of virus, make sure that they don't mutate so much to a point where it doesn't respond to the treatment or it doesn't pick up by the current diagnostic lab that they have at this point. The variants that of concern, and they still pick up by the diagnostic lab, and they're still within the efficacy of the vaccine. So I'm sure they do that all the time, Chris Springer, just to make sure that nothing coming out on the variants of I guess high consequence or something.
Right.
Does the pack get a breakdown of the age groups on the vaccines? Like how?
Yes,
we just open it up to 16-year-olds and to 40.
Yeah, those are information I think supposed to be on the jig on the number of vaccine and the age group. I know when we're open to 16 and older, the young population, the 18 to 40, they come out a lot. So thank you so much for that age group to come out to UOG to get vaccinated. They come out in force. So that's one thing we have to love about Guam, and people are very receptive to vaccine, and that's helped our island a whole lot.
Doc, you mentioned the flu shot earlier, so I'm just wondering, with the COVID vaccine, is this something that because all these variants that we're going to have to be taking every year?
That most likely, it's like I say, when they do the genome sequencing all the time, and I'm sure they collect whatever changing, and then if they think it's pertinent, they're going to make the vaccine for the next year. So I think like or not, it's going to be an annual shot, just like a flu shot.
Yeah,
Hopefully, it's not a two-shot series.
Yeah.
have they started administering the Johnson and Johnson vaccine?
Uh, I I think that's for the homebound and also for the homeless. They should start it. I think there's vaccine clinics. I think coming up here in the next few days for I think for the homeless. They should be able to. It's a small number. I think it's like 1,500. It's not that big of a number. So they should get that out to the bedridden homebound patient, and also for the homeless and the senior center very soon. So I think that this week they'll be giving the first one. I hope.
So as part of the 50,000 doses that we're expected to receive, you said for April, do you know how many of those are going to be the Johnson and Johnson?
I think around 11 to 1,200.
Still,
Very small percentage. Yeah.
Wow. Okay.
And also, where can we get the breakdown of the numbers, the demographics for the vaccinations? It's not on the JIC.
Sabrina, it's not.
No.
Oh, okay. Yeah, I think it's important for them to release that. Someone asked, public health, see if they can release that. 'Cause I think it's important for people to know.
Yeah, it is. Go get mad at them.
Yeah.
You're
Okay.
right, Doc.
No. Don't get mad at them.
Yeah,
I
get
put
mad
the
at them.
request in.
Okay.
Well, I don't think we need
Don't
to
get
see any more
mad.
doctors getting mad.
I like it when the doctors get mad. It's entertaining. Thank you, Doc.
Okay, guys.
Okay, see
All
you.
right, stay
on.
safe.
There you go. Dr. Hoa Nguyen of the Physicians Advisory Group. It's 8 o'clock. Let's hit the phones. We actually had a call here from Aaliyah. Good morning, Aaliyah.
Good morning.
Good morning.
Thanks for listening. You had a question for us?
Yes, I had I was just wondering what that song was that you guys played.
The upbeat rap one?
Yeah, that one and the one with the girls singing.